Hundreds have been turning out to the Radisson Grenada Beach Resort every day since Monday, as government announced a week of mass vaccination targeted at frontline workers and workers in the tourism and hospitality sectors. The numbers have not only been evident in St. George, as the sister isle of Carriacou reflected same, as Grenadians search for answers to end the COVID-19 pandemic. Curious to know what the numbers have been like, GBN ventured down to the Radisson Resort Thursday to speak to Dr. Shawn Charles, Acting Chief Medical Officer in the Ministry of Health. Dr. Charles says the numbers have been impressive so far.
The numbers have been, frankly, beyond our expectation. On Monday, we vaccinated 255 persons here on the first day. On the second day, which is Tuesday, that number rose to 604. So we vaccinated 604 persons on Tuesday. On Wednesday, that number increased again. So on Wednesday, which was yesterday, we vaccinated 748 persons. So the demand has been sort of exponentially increasing. Carriacou has been pretty good as well. On the first day, they conducted vaccination only for 3 hours and they vaccinated 111 persons.
Questioned about the age range and characteristics of the people allowed to receive the vaccine, the acting CMO explained why the vaccine is not approved for children and pregnant women, adding that studies are ongoing to rectify both situations.
When these studies were done initially, it was done in persons 18 years and above. All right, so we do not yet have data for children. However, there is presently a study ongoing in the UK where they are giving the same AstraZeneca vaccine to children. The same goes for pregnant women. All right, because these were not populations that were included in the first study group, we do not yet have enough information to make a decision as to whether they should take it or not.
The cutoff number for vaccinated people in this instance is 3,000. This, as Grenada received 6,000 vaccines so far, which need to be administered on a 2-dose basis.
So remember, we got an initial batch of 6,000 vaccines. So we took the decision to make the first and second dose available for the first 3,000 persons. So once we arrive at that 3,000 mark, then we are going to hold. And then in 8 weeks, we will give those persons the second dose so they will be fully protected. Now, we are hopeful that we will receive our allocation of vaccines, all right, or additional shipments of vaccines so that we can continue, all right, beyond the 3,000.
Vaccination will continue as long as vaccines are available. The CMO says the next targeted recipients will be citizens 65 and older and people with underlying health conditions. For GBN News, Janelle MacDonald.